Hey guys, it's Jessica. Sorry I can't make it today. I'm sick with the flu. I still wanted to do my part though, so I'm just going to read out my section of the presentation. Challenges of cerebral palsy. While working in the schools, we'll be working with students with some form of cerebral palsy. As mentioned before, CP can range from mild to severe, which means the needs of the student can be as simple as assignment modifications up to 100% reliance upon the education assistant, which may include tube feeding, toileting, etc. Through our research, we found many possible challenges for people with CP. These may include, but are not limited to, CP affects muscle control and coordination, so even simple movements like standing still are difficult. Other functions that also may involve motor skill and muscle, such as breathing, bladder, bowel control, eating, learning. Premature aging. Majority of individuals with CP will experience some form of premature aging by the time they reach their 40s because of the extra stress and strain the condition puts on their bodies. Developmental delays that are often accompanied by CP keep some organ systems from developing to their full capacity and level of performance. As a result, organ systems such as the heart, veins, arteries, and lungs have to work harder and they age prematurely. Depression is also very common. The rate of depression is 3 to 4 times higher for people with disabilities such as CP. It appears to be related not so much to the severity of the condition but to how well people cope with it. Functional issues at work, challenges at the workplace are likely to increase as individual with CP reaches middle age. Post-impairment syndrome, which is a combination of pain, fatigue, and weakness due to muscle abnormalities, bone deformities, and arthritis. Osteoarthritis and degenerative arthritis. Abnormal relationships between joint surfaces and excess joint compression can lead to the early development of this painful osteoarthritis and degenerative arthritis. Pain can be acute or chronic and is experienced most commonly in the hips, knees, ankles, and the upper and lower back. Two of the other ones left is seizure disorder. As many of half the children with cerebral palsy will have seizures. They can take the form of the classic convulsions of the tonic-clonic seizures or the less obvious partial seizures in which the only symptoms may be the muscle twitches and mental confusion. Mental retardation. 2/3 of the individuals with cerebral palsy will be intellectually impaired. Mental impairments is more common among those with spastic quadriplegia than in those with other types of CP. And children who have epilepsy and a normal EEG or MRI are also more likely to have mental retardation. Again, this is not all of the challenges, but an overview of the most common ones that we've run into. The severity of the challenges will be different for each child we work with. While working with a student with CP, it's important to have some strategies for your students, which could include being aware of your surroundings. For example, the tripping hazards, do risk assessments, even if just visual, for all the spaces that you're in. Adaptation is key. Figure out ways to adapt everything from the student's pencil to games in the gym to involve them as much as possible with everything that the class does. Teamwork is important. Together with the students, parents, teachers, physical therapists, etc., strategies for success, goals, and adaptation should be able to be figured out. Remember, although the student has a serious health condition, they may also have ordinary interests and hopes and dreams. Make sure you know them and try to keep their school life as normal as possible. Also, recognize their strengths. If possible, maximize the student's space to benefit them to the best of their ability. Encourage and promote peer relationships, example, buddy systems and group work. Keep your student active in whatever ways possible. Do your research on the student's disability and possible challenge and always ask questions. If you're unsure, ask away. Have fun. I personally have learned many things throughout this year of this course, but the one thing that stuck in my mind is to have fun. Lastly, while I was doing research on the challenges, I found an amazingly heartwarming video that will be a benefit to any student that we work with. It's about a man with cerebral palsy who rock climbs. So my little thing is that never set limits too low. With persistence, help, and encouragement, any child can reach the stars. Enjoy! Thanks.